Hi, folks. So I think we're giving ample time for people to join in. We'll just get right into it. The session is being recorded, so people who miss out on the beginning stages can easily refer to the recording for today. Welcome, everyone, to an important Key Informant interview discussion on the future of healthcare in Rivers State. This is part of the Rivers 2050 vision. I will do a quick intro to the conversation, and then I'll hand over to our task force member, Senite Wokoma, to be able to take us forward into this conversation. You'll notice that you can't unmute. That's because we're trying to control the room so that we only allow the speakers to be able to unmute. However, we'll have a question and answer session. So when that time comes, we'll be able to ask the questions for as many that Senate can take during that time. Okay, so if this is time, we free to 100 young Rivers people from local government areas outside of the state as well to come together with experts, just as we're having today, one of the key experts in healthcare, and international partners to be able to craft a 25-year blueprint for states. We started our focus group discussions 2 weeks ago, and we're going to have 14 other focus group discussions across key thematic areas. All of these are housed on YouTube. So just in case you haven't seen any of them, you haven't missed so much, they're all on YouTube. So you'll be able to refer to them whenever you want. The YouTube detail is there on the screen. Also, we had launched a website called rivers2050.org, where we house, again, all project information, but also the Rivers 2050 survey, because at the heart of this project is the people, right? Like the reason why we're doing all of this is because we want the people to be able to craft the future that they want to see for themselves and also for our own children. And so if you go to rivers2050.org/survey, you'll be able to add your voice to the survey and also do well to share the link with others as well. Everything will come together, all of these conversations, the survey insights, the key informant interview we're having today, the discussion with experts from around the world, will all be put together into the Rivers 2050 vision book, which has already started work. The book committee is working really hard, putting those insights together in collaboration with the focus group committee. So we plan for this to be launched sometime in 2026, hopefully in Q1 or early Q2. So yes, please make sure that your voice is part of this, because we hope that it becomes a manifesto for our collective future. Okay, so we've been doing this thing where we've been using AI to imagine the future across several areas. And to kick off today's conversation, we're asking, if you go to our website, rivers2050.org, you'll see all of these visual features that were created using ChatGPT. But when we asked AI to imagine what the future of healthcare would be like, this is some of the right? Things like elder care, something that's not so popular currently in our state. That's something that we can begin to think about so that people can age with dignity. I mean, in other developed climes, that's part of their culture already. If you look at the image at the center, one of the things I was telling someone this morning is that all of the medical professionals are smiling, which means that they are paid well. They're paid well and they have old salaries. More equipment around, right? You can see diagnostics lab with modern equipment, and of course, people across genders, right? It's just you have male, female scientists and stuff. So this is just a snapshot. Obviously, when Asanite goes into the conversation with our guests, you'll see the future can be, or what AI does think the future can be. And I think it challenges us, right? If AI can imagine this far, how much more us with our, unique and powerful brains. So we'll be looking forward to hearing a bit more about that once we speak to our guests. Okay, so I'll introduce our guests now, and I'll hand over to Asenite. Dr. Adaeze Oreh, who's been here from the start. Thank you so much for joining early. She's a consultant family physician, public health specialist, and she's the 27th Health Commissioner of Rivers State. Prior to her appointment, she was the pioneer country director of planning, research, and statistics for Nigeria's National Blood Service Commission, that's the NBSC. and also a senior health policy advisor of the Nigeria's Federal Ministry of Health. With over 2 decades of a private and public sector healthcare experience, she was a member of the Pioneer Governing Council of PAMO University of Medical Sciences. That's Nigeria's first private University of Medical Sciences. She's a fellow of the West African College of Physicians, Kofi Annan Global Health Leadership Program, Aspen Institute, Aspen Global Innovators, Royal Society of Tropical Medicine and Hygiene, Royal Society of Public Health, and a member of the White Ribbon Alliance for Safe Motherhood Global Advisory Group, as well as the International Society of Blood Transfusion COVID-19 Convalescent Plasma Working Group. She advocates for respectful, quality healthcare, health equity, universal health coverage, and quality medical education as well, and was invited to share her perspectives at the 74th United Nations General Assembly in 2019. In 2021, she was one of the 15 accomplished Amuje leaders in Africa awarded by President Ellen Johnson Sirleaf. That's the first female president on the continent, former president of Liberia. Her presidential center honored her for women and development. And of course, this is a brief summary of her bio. She's also an alumni of Harvard Kennedy School, which is where I actually got to meet her first, being an alumni myself. And we're really excited to have her here today because she's been very supportive of the work we've done. She's been pushing the survey as far as possible and helping us to get connections to the various leaders whom we've been inviting to get on our town hall. So thank you so much for joining us now. We look forward to the conversation. Over to you, Asenite, to take it away. So I've sent you the request to unmute Asenite, so you'll be able to unmute now.
Okay. All right. Can you hear me now?
Yes, we can. Cool.
All right. Good afternoon, everyone, and thank you, Mrs. Oreh, for joining us on today's session. We're really excited to have you, and we're looking forward to hearing your insights and how we can move River State forward health-wise. So, firstly, Adaeze has already read out a few things, but I would like to hear from you directly. So first, tell us a bit about your medical background and some of the work you did before you became a commissioner.
Thank you very much, Policy Shapers, for inviting me to this interview today. I've been keenly interested in what you're doing and the vision you're trying to conceptualize with voices from around the state and even outside the state to craft a vision for 2050. And it's an honor for me to be here. Thank you very much. And before I start with the question, I just wanted to share something funny. While I was waiting for the meeting to start, you had music on from our own revered Sir Rex Jim Lawson. When I was in medical school, I had a tradition of playing Sir Rex Jim Lawson every night. And so my hostel door, my room door would be open, and the music will be streaming out into the rest of the hostel. And a classmate of mine said, her uncle who used to visit said, which old woman do you people have in your class that is blasting High Life every night? Only for him to see me, and I was the youngest in my medical class. And it was just something I found very funny. But for me, who trained in Enugu, it was a way of taking rivers with me to school. So I just thought I'd start the interview on that note with everyone here. So good afternoon, everyone. And thank you, Ebenezer, for that amazing introduction. At a point, I had to pinch myself. Is that actually me being described? And thank you, Asenite, for kickstarting the conversation. So before my appointment, I had been in the federal civil service since 2009. And basically, after graduation from medical school in 2003, I went on for a master's degree in the UK in international health management, basically because by the time I was finishing with medical school, I felt that Nigeria's problem was not subspecialists. It wasn't having enough, say, cardiologists, heart physicians, or kidney specialists, or surgeons. I felt that there was a major gap in health policy, planning, and management. And so for me, after internship, it was about going to get my master's degree. And so after internship, house job, and youth service, I went, got that master's degree, and was intent on coming back to Nigeria to work in the public sector space. Many may not know that my family background, we've had a private health facility that's over 40 years old. So I had that private sector experience as well, but I was keenly determined to go into the public sector. So I returned after the master's and there was no vacancy, got interviews in the ministry, met with the minister, met with senior directors, because at the time there was some embargo on employment and it hadn't been lifted. And the minister then said to me that she would love to take me on her staff, but that wouldn't be a permanent role and it would kind of be ad hoc. So I opted to volunteer with the ministry. And so I volunteered for about 7 to 8 months in the Federal Ministry of Health, rotating through different departments, getting involved in public outreach programs, building networks. And towards the end of that time, I got information that there was an interview at the National Blood Service. And so I went for the interview, basically to take on the role, to possibly take on the role as a data technical officer. But after the interview, I was offered coordination of the blood service in Abuja, in Niger, and in Nasarawa State. Now, it sounds very streamlined and very clear and simple, but in a nutshell, while I was volunteering, I had also volunteered in the blood service. So when I presented myself at the interview, I was speaking quite knowledgeably about what the blood service was all about. And even though I was interviewing for a particular role, unknown to me, a vacancy had come up. And so I was offered that leadership role in that time at the blood service. And that's what kickstarted my public sector career. Somewhere along the line, I went to complete my residency in family medicine, working in specialty hospitals in Abuja and Nasarawa states, and got my fellowship in family medicine, making me a consultant, and then having to return full-time back to the ministry. And on my return to the ministry, I identified that there was a gap in the blood service. Now, I had a blood service with a national coordinator or director general. You had the arm for blood services that worked with communities. You had the arm for laboratory services that looked at screening. You had donor recruitment, donor management, but there was nothing on planning and there was nothing on research. And so this was a period of a transition where a national coordinator was handing over to another. So I congratulated the incoming national coordinator with a letter and attached a proposal for this establishment of a unit for research, development, and innovation in the blood service. And just for completeness, attached my CV. And I think the following day, I was asked to come in for a meeting with him, and I was offered the role as the pioneer country director for planning, research, and statistics at the National Blood Service. When I was sending that concept, I didn't know that he also had in mind the fact that there was a gap in planning and research, because he was coming from the federal ministry setting into the blood service, and he was thinking about how to solve that problem. So what my letter did was give him a potential solution to solve the problem. And so I happily took on the role. And then they gave me about 2 days and I had my marching orders. So apparently the blood service was supposed to make a public presentation to the National Assembly in approximately 2 weeks. And I was charged to prepare the presentation that the Honorable Minister would make to the National Assembly. So talk about pressure. So I worked with my team and we got it going, and that signaled the end of an 11-year journey of establishing Nigeria's first law on blood safety in the country. And President Buhari signed that bill into law in 2022, but it's actually the law for 2021. So why I'm sharing this is the fact that as young people, you know those things that drive you, you know what your passion is, where your areas of interest are, but you should also be looking around you for problems to solve and be willing to stretch yourself a bit, put yourself out, make a little sacrifice so that you can be seen as a solution. And so for me, the volunteering, which wasn't easy, putting myself out there with no pay, was a sacrifice that I made for the networks and the opportunity to learn of when there was an open door that I could walk in through. And of course, I don't underrate the fact that in that time, there were definitely people who would happily speak about me in rooms where I wasn't. And so that's why I thought to share that. So one of the landmark things in my time at the National Blood Service was the establishment of that law for the country, which is still the prevailing law on blood services in Nigeria. And many other initiatives around information, communication, and technology, a blood donor management system, which we initiated, which is functioning now. And so by the time I was coming into the Rivers State government, I think I was at a point where I felt that every vision or objective that I had for that role, I had pretty much achieved. And so I was doing more in the academic space, contributing more to Pamo University of Medical Sciences on the governing council, serving as adjunct senior lecturer at Bayes University in their Faculty of Health Sciences as well. So I was more in the academia space, mental space, and thinking of how to give back to the next generation of public health sector leaders.
Okay. Well, that's a lot. We're very grateful for your service anyway. The law, I'm sure, is going to help in saving lives. The one passed in 2021 by Buhari. So we're very grateful for your input. Even if we didn't know at the time who the people behind it, we can see now how it has come to help. So next, I would like to know, or we would like to know, some of the key milestones we are proud of in your time as Commissioner of Health in Rivers State.
So there were numerous milestones, but I think I would like to also share the fact that I was a bit strategic after the appointment. First of all, I knew that I was coming from the federal sector space into Rivers State. I mean, I was born here, I was raised here, but by and large, the majority of my working career experience was outside of the state. So I didn't make any pretenses about the fact that I needed to understand the healthcare ecosystem within the state. And for that, for literally the first month, I didn't put together any memo of recommendations to His Excellency, the Governor. I spent that time in conversations with health sector leaders within the state, in the ministry and outside of the ministry. I spent time going to every single department within the ministry for them to walk me through their day-to-day work, their vision, their achievements in the past, and where they saw their departments contributing to the ministry in future. So I spent a month doing that. And the insights that I got from that time were invaluable because it helped by the time we were now conceptualizing the Rivers State Health for All strategy. And I would like to point out here that oftentimes public sector roles I just said to someone a few minutes ago that it's like a high-speed train on steroids. There's little time for conceptualization if you are not intentional about making that time, because activities and responsibilities can take every second of your time. And so for somebody coming into that kind of role, you really have to be deliberate. You have to be honest with yourself about your strengths, your weaknesses, and the opportunities that may exist. So by the time I was done with that, something was clear to me. At that time, Rivers State was the only state in the federation that hadn't started implementing state health insurance. And it wasn't because the law wasn't present, because the law had been passed in 2021 in the state. So there was an enabling law, but for one reason or the other, it just hadn't kickstarted. So I felt that the very first memo recommending an initiative to His Excellency should be on state health insurance. And for me, it was especially important because financing, healthcare financing, is one of the crucial pillars of any health system. So a lot of times we think about the health system in terms of the brick and mortar healthcare facilities, the Rivers State University Teaching Hospital and its beautiful buildings, Kelsey Harrison, the primary healthcare centers. But that connection between a family person, say a man or a woman, moving from their home to access healthcare in any one of these facilities, aside from the geographical accessibility, financial access is crucial. And so I thought that that was a major thing that as a state, we had to begin implementing. And so my very first recommendation memo to His Excellency was for the state health insurance. And so having said that, you can tell that his approval for its implementation, which came in January of 2024, was a very, very emotional and heartwarming thing for us in the Ministry of Health. The other thing was that you see where there's discontinuity between one administration and the next, because everybody wants to come make their mark, and oftentimes projects from a prior administration are abandoned in favor of new initiatives that are supposedly meant to showcase the incumbent. And so the commissioning and the operationalization of the Kelsey Harrison Hospital, Professor Kelsey Harrison Hospital, under the Rivers State Hospitals Management Board, and then the Dental, Maxillofacial, ENT, and Ophthalmology Hospital in Garrison, that were projects initiated under the previous administration, under His Excellency Adaeze Oreh, commissioned under Governor Sim Fubara, was evidence of continuity for me. So I took pride in the fact that we were seeing continuity in government for the benefit of the people. So that was another point of pride, if you say, in what we could achieve within the Rivers State Health Ministry. Another thing was primary healthcare innovations. So by the time the administration was marking its first 100 days in office, 10 primary healthcare centers had been upgraded and renovated across the 3 senatorial districts of the state. And going forward, as at now, with the 135 that are being revitalized in collaboration with the World Bank, that brings the number of primary healthcare centers renovated under the administration to upwards of 175. Another thing was the reactivation, I would say, of emergency medical services and ambulance system in the state. Because that is also another sensitive area. You have a lot of people, Rivers State is a very vast, highly populated state, people in different parts of the state, and they need geographical access to a health facility. If such a facility is not right next door and they're unable to convey themselves, there needs to be a working system that can get them the help that they need, either where they are or convey them to where they can get that help. And so the reactivation of the emergency response services in July of 2024 was also something that we're really, really proud of. Another thing was regarding human resource for health. So you had a situation where a lot of the healthcare workers had been in an environment where there was stagnation, there weren't promotions, and those promotions were unlocked, and people started receiving at least something close to their cadres having been promoted. Because, like I like to say that the workforce is the lifeblood of any health system. So you can have your fancy buildings with all the equipment, and if your human resource for health isn't quite right, you don't have the numbers, you don't have staff who are remunerated and feel recognized and acknowledged for the daily sacrifices that they make, then you are being counterproductive in that health system. And so that's also one of the things that I'm especially proud of. In addition to the employment of 2,000 health workers across both the Hospital Management Board and the Rivers State University Teaching Hospital. So these are health workers that can be deployed, aside from those in the teaching hospital who would of course be in the state capital. But those for the Hospital Management Board will be deployed across the state to contribute to the manpower that is available in our communities, in the general hospitals, in the cottage hospitals, and in the zonal hospitals within the state, so that healthcare provision is strengthened, not just in Port Harcourt City, but at the community level as well. Then we were able to get an increased quota for admissions for the Rivers State College of Nursing Sciences from the Nursing and Midwifery Council of Nigeria. They increased our quota to 142%. So that too would feed into building a sustainable pipeline of healthcare workers within the state. Payment of outstanding promotion arrears, as I mentioned before, payment of reviewed consolidated salary schemes for health workers, payment of hazard allowances. And I'm emphasizing these because these are crucial ways of recognizing and acknowledging the health workforce. We're talking about brain drain consistently. A lot of that is remuneration based. A lot of that is because people don't see a future for them or a career progression, or even the benefits of a so-called career progression if they aren't properly remunerated. So even though it's not at, optimal or ideal, I'll use the word ideal, it's a work in progress, and those steps recognize and acknowledge the importance of it and make room for improvement in the future. And a lot of our work got recognized. We won the South-South Award for Primary Healthcare Leadership and this award is by UNICEF, the Bill and Melinda Gates Foundation, Aliko Dangote Foundation, and the Nigeria Governors Forum. There were also several awards that the Rivers State Ministry of Health was recognized for. And of course, for me, they were a collective effort of the teams in the state. So when people would ask, oh, you guys have achieved so much in Rivers State in this short period of time, did you move into the state with teams? And I'm always so proud to say to them that the teams that I worked with all within the state. I only came into the role with a personal assistant. Everybody else that I worked with is from the state, within the state, homegrown, built capacity, built experience here within the state. So for me, it's even validated the accomplishments because we didn't outsource the process of succeeding within the state health sector or transforming the state health sector. It was all built from here within the state.
Wow. Well, there's been a lot of what you mentioned I was unaware of before now. So thank you very much once again for the amazing work you've done so far in the States. We're really glad to hear and see that there's people that have the States at heart and are ready to work for the betterment of River State. So thank you once more. There's a bit of some not so great news regarding our health in River State. Since River State has been branded as the HIV capital of Nigeria this year, recording the highest number of HIV cases. What can we do about this?
Yeah, so I think, first of all, I think this is a good point for me to wear my researcher hat and say, sometimes when we see headlines, we should take them with a pinch of salt. And I will say this, I'm not undermining the data that was presented, valid data, but there's something in data called cherry picking. And you have a lot of data that is thrown at you and you select and decide what you want to blow up. And so all the headlines had River State, Nigeria has 2 million people living with HIV and River State is at the top. And remember, there's also the timing component. The timing of that report coincided with the state of emergency in Rivers. So you know that already, algorithm-wise, Rivers was up there. And if you wanted the nation to pay attention, media now, you want the country to pay attention to what you're putting out there, you better put Rivers first. And so why was Rivers cited as number one? It was cited as number one because the state recorded 208,767 people living with HIV. Okay? Now, that 208,000 people compared to our population of over 9 million, our prevalence as a state is 3.6. Compare it to the 202,000 reported by Benue compared to their population of what? About 5 million, 6 million? Benue is about 7 million. Akwa Ibom is about 5 million. And they too had reported about 161,000. So if you're looking at the prevalence itself, for River State, our prevalence is 3.6. For Benue, it is 4.8. For Akwa Ibom, it is also 4.8. So now taking that number, that raw number of people living with HIV and saying River State is the captain of HIV in the country, I don't have a problem with it as far as it helps us do more to address that public health problem, which is HIV. But it is also from our being a victim of our success. Now, there's the joint program for HIV/AIDS with the United Nations, UNAIDS. They released this spectrum estimates that we're citing. There's something UNAIDS has as a target for countries, for states, for anybody who wants to address HIV as a public health issue, the 95-95-95 targets. Basically, what is it? It says that 95% of people who are living with HIV know their status. It says that 95% of people who know their status are on treatment. And it says that 95% of people who are on treatment are virally suppressed, right? So they're virally suppressed. It means they are HIV is literally undetectable if they're tested, and it minimizes to the barest minimum the possibility of their transmitting it to another person. For River State, we're at 97, 95, 96. So what that tells you is that 97% of the people living with HIV and AIDS in River State know their status. And it is from that knowledge of their status that we could report 208,000 and above living with HIV, meaning that more people in the state are aware of their HIV status. So that's why I said sometimes, you report and it comes back to seem like you're at the shorter end of the stick when actually you're doing quite well. So there's a lot of work to be done in HIV. And one of the things that I would hope going forward is an increased establishment of prevention of maternal to child transmission sites across the state, so that many more women who enroll for antenatal care and are living with HIV have the care and the support that they need so that they can deliver their babies safely without transmitting the infection to them. Because that's also another way of heavily tackling new infections and reducing the number of children who would be living with HIV. So some of the work that we did in HIV, which was actually commended by the United States government last year when the Consular General visited the state, was enhanced HIV testing services to over 4.8 million people that in the low, especially in low LGAs that had higher numbers of estimated people living with HIV. So we took these testing services even to the doorsteps of residents in communities. We increased the number of facilities that provided antiretroviral therapy. As at the time I came on board, it was about 88 facilities providing these ART services, and we're able to increase it to about 114. We expanded, as I said, PMTCT, prevention of mother-to-child transmission services, to communities, and we witnessed an increased uptake. We still have more to do in scaling these services, but at least the results that we have so far are very encouraging and reassuring. And commencement of ART, the antiretroviral treatment, for over 140,000 people living with HIV. We strengthened laboratory services and got commended for our documentation as the #1 in the country for documentation of laboratory results for HIV in the River State University Teaching Hospital. And then enabled electronic medical records systems and telemedicine platforms in more than 158 facilities in the state. And then there was also the clinical mentorship program, which we piloted in the state and was adopted by the Federal Ministry of Health as a national program. So a lot of these efforts have gone into the whole HIV response in River State. We're not saying the work is done. There's still so much more that we can do. But even when we look at the data, for us in River State, the number of children living with HIV, I mean, the national number is about 158,481, and we contribute 11,134. This is compared to 19,000 in Benue and 12,000 in Akwa Ibom. So I hope somehow I've explained that when we see these headlines, it's not always a bad thing. Sometimes it indicates that you're doing work, people are getting tested and they're knowing their status, but it shows up as though you enter River State and you walk out with HIV, which is not the case. So let me sound like those secondary school. With these few points, I hope I have convinced you that. Thank you.
Yes, River State is no longer the capital. of HIV in Nigeria. So yes, we are convinced. It's unfortunate headlines can be used to make great work look bad. So thank you for enlightening us on this aspect. I heard you talk about mother and child transmission. This would be a good time to ask. Rivers State has had a mother and child hospital and a cancer center built, and both are locked up. So why are these facilities not open for use by Rivers people? And what can we do to open them up?
Okay, so when both hospitals were commissioned by the River State government under His Excellency former Governor Wike, his concept for those hospitals was public-private partnership. A lot of resources had gone into equipping the hospitals, ensuring that they were of global standard and available to deliver quality services to the people of River State. But sometime in January 2024, so now you have public-private partnerships that are usually a consortium of different entities, right? Some partners bring some funding for the operationalization. Of course, River State has brought these facilities with the massive equity within it into that partnership. So that was the stake of River State. And so in January 2024, if you remember, by this time, there was some economic downturn. There were issues around financials globally. And one of the funding partners indicated that they would not be able to proceed with the partnership because of their funding constraints. And so at that point, the state now had to re-strategize. Obviously, there were agreements that would have to be terminated and all that. And of course, with state bureaucracy, that takes quite some time. So, but just fast forward to where we are, because I think even before that particular specific partner mentioned their financial constraints and challenges, I think I had shared something on I think it was Twitter then, not X now, that we were anticipating that services would commence by the end of 2023. And so it was in that process of pushing the partners what's happening. We've promised the people of the state that these facilities will be open. So in those conversations, it was now eventually in January that the partner said, look, we are having financial issues. We're unable to proceed because part of that partnership means, staffing, operationalization, day-to-day running of those facilities. And so it was at that point we now had to return to the drawing board and see what prospects were available for the state to ensure that those facilities are positioned to deliver quality services to the people. So that is one of the downsides of public-private partnership. I mean, if it was solely public, anyhow, the facility will be open. There may not be lights, staff may be minimal, but the facility is open. And that was something that the former governor didn't want and the current governor didn't want either. They wanted the facilities to stand as flagship facilities. So as at the time of the declaration of a state of emergency, we were already in, reviewing multiple proposals from other intending partners and looking to taking those conversations forward to ensure that we get the facilities open for use by the public.
Okay. Well, this is news to, I'm sure, a lot of us, because this is like one of the conversations that's always happening on the streets, and people are like wondering why would they do this?
Yeah,
There's all sorts of
I know
propaganda going about.
Yes, it's one of those. I mean, they are very prominently located, both hospitals, both the mother and child hospital and the Cancer and Cardiovascular Hospital, both very prominently located. Both were very publicly commissioned. And, you know, of course, there was a lot of hope attached to those facilities. And of course, they are public facilities. Therefore, the people would want to know that what's happening. These facilities were meant to be open, especially if they go to any one of the other facilities within the capital and they experience waiting times or one challenge or the other, and they're like, especially if it's maybe in child health, and you're like, if the mother and child hospital was open, I wouldn't have to go through this. So because of the driving need behind the establishment of those hospitals, it is perfectly understandable that it will always be a burning question for the people as to why are these hospitals not open. And so in a nutshell, that is the situation with the hospitals. And hopefully we'll get to the point where they are sufficiently manned, operated, and managed so that people can benefit from the facilities.
All right, thank you very much. We are looking forward to that day, hopefully soon enough. You spoke about healthcare insurance in Rivers State. So how can we broaden this healthcare insurance coverage for the Rivers people? I think you basically you know a lot about this because you're a part of those that brought it to life in the state. So tell us, like, how we want to know how we can broaden the healthcare insurance coverage for the citizens of Rivers State.
Okay, so when you ask about broadening the coverage, what is it specifically? Is it broadening the reach? Is it across the state, or is it in the, because currently the annual premium is about 15,000. So is your question about increasing that, or, you know, just guide me, please.
Okay, so I think first we need to understand how it works. So for me, I have no idea how it works.
Okay.
Okay,
and I've seen a comment from Ebenezer. It says reach. Ebenezer says reach. So okay, so let me take it from that angle. So as at now, the health insurance is available across all 23 local governments of the state.
Okay.
We have recorded in the last couple of weeks 100,000 people enrolled under both the vulnerable people scheme. So when you say vulnerable, you have those who are children under the age of 5, you have pregnant women, you have the elderly, you have persons living with disability, and people who are living in abject poverty in communities. So those are within that 100,000 that have been enrolled so far. Now, the other aspect of broadening the reach is we have a structured civil service. Now, let me also share that in our law for the establishment of the Rivers State Contributory Health Protection Program, it is not mandatory to sign up for health insurance. And so that in itself tells you there would be challenges, because you then have to convince people about why they should sign up. It also has a benefit. It means that the state health insurance and the state government too cannot be complacent, because it is in ensuring the quality of the health insurance that you provide that will enable people to speak well of it and encourage their family, their friends, their colleagues, their neighbors to sign up. Unlike if it's mandatory, people have to sign up whether the service is crap or not. So that's the way the law is structured, actually gives power to the people. So now we need to ensure that the quality of the health insurance program is satisfactory to the people so that they will enjoy the benefits and speak well of the benefits and get more people on board. So back to the question about reach. Say we want to expand in Thai local government area now. And a lot of the community residents who had signed up have been recording experiences of going to the health facility and being turned back for one reason or the other. So when you go to Thai and you see the community gatekeepers, maybe it's the traditional ruler, maybe it's the leaders of the groups like women groups or youth groups, and they confront you with those negative experiences of majority of their people who are enrolled, you have to do something, because what they're saying to you is, until you get your act together, we're not going to enroll our people. We're not going to encourage our people to come and enroll. You're not doing well. Unlike if it was mandatory. So if it was mandatory for a lot of the civil servants, the deductions will be taken at source. They have no say. But as it is now, you need to willingly sign up. And I see that there are questions about getting information. So RIFCHIP, which is the acronym for the Contributory Health Protection Program, they have a website. They're active on social media. But I will share all those details with policy shapers so that you can disseminate to those who are asking, because contacting them directly, you can sign up, you can get more information about the different benefit packages that are available. The 15,000 I mentioned is the baseline package, and people have been benefiting from it. So to scale, that is ensuring quality is one way, and actively engaging community. So that's something that is done in RIFCHIP under the leadership of the Acting Executive Secretary, Dr. Agala. They work and interface very directly with communities, civil society organizations, to get people from the communities on board in each of the local government areas. So it was something like a moving train when they were first going to different local government areas. They would make the announcements, sensitize the people, and do a public enrollment launch over, say, a week or several days in a local government, depending on the population volume in the said local government. The other thing is about continued investment in health. And so I will not be speaking about this skirt around the fact that indeed government has to continually invest in health insurance. So bringing out funds dedicated to, say, enrolling a specific number of people per local government area, people with specific needs, for example, persons with disability or the elderly. One of the AI-generated things was about elderly care. You know that with advancing age, there are many chronic illnesses and differences that happen with aging. And a lot of those things require some form of healthcare support. And so with that continued investment, it may be targeted. Say, okay, it's a targeted fund for elderly care, or for pregnant women, or for children, or for school-age children. And that way, you are in a position to mass mobilize a large number of people who will be coming onto those expanded funds, adding to the numbers and widening the reach of people benefiting from the state health insurance. So we can't run away from the fact that there needs to be continued health investment in insurance.
Okay, I think pretty enlightening information, new information for most of us here on this meeting. So we're thankful for the work you constantly, for the work you've started, and we're thankful for how far it's come. We see there's a lot of strides already taking place from at least let's start with your tenure up to this point. A lot of things have happened, and there's still a long way to go. So over the next 25 years, what should the healthcare of the future in Rivers State look like? What do you think it should look like?
I think that the healthcare space in Rivers State should be one that is accessible to all. So we're pretty deliberate when we crafted the healthcare strategy as health for all. Because oftentimes when we think about health, a lot of the attention is on, say, the teaching hospital setting, ensuring that there's advanced level equipment and, everything is top of class, but maybe the primary healthcare sector is neglected. The general hospitals, the zonal hospitals, even the cottage hospitals are abandoned. So across the board, there's a lot of attention in at one level, while the other levels are struggling. So for me, in 25 years, we should be able to say that every single person who is in the state knows the nearest primary healthcare center to them. It is not more than 5 kilometers from where they reside. And they can walk in there and they have geographical access to primary healthcare, and they have financial access, meaning that they do not even have to bring out funds from out of their pocket. There was a health survey that we used in crafting the memo for His Excellency. That survey was done in 2022. That was prior to my appointment, but it hadn't been written up and developed and printed until I came in. And so we interrogated the results of that survey. And where the national average of out-of-pocket expenditure is about 74%. And nationally, everybody is crying that, Nigeria's out-of-pocket expenditure is one of the highest on the continent. Guess what? In Rivers State, it was over 90%. Households had to cough up over 90% of the funds required for healthcare. That means that there are families who would decide between a meal and getting a member of that family access to healthcare. That is not a decision any family should make. And so for us, it emphasized the importance of our getting universal healthcare protection through health insurance for our people. And so we should be a state where there is that social health insurance pool. Now, the beauty of the pool is that people like Asenite, who go to the gym 4 days a week, who drink only water, who don't drink soda, soft drinks, they are lean, mean machines, and they live a very healthy life. They don't smoke. They maybe only drink a glass of wine at a party 2 times a year. People like that who are statistically, or the probability of them needing regular health care cross-subsidize those who have regular health challenges. So you bring the pool, everybody is contributing into that pool somehow. It may be from government, it may be from formal sector, it may be from the informal sector, it may be from just voluntary contributions of people, but it cross-subsidizes. So for those people who have, say, sickle cell disease and they have to be in hospital every now and then, or people who have hypertension or diabetes, they don't have to go and sell land or promise somebody their car to hold while they borrow money so that they can go and get healthcare. So that's the beauty of the health insurance pooling system. And that's something that I believe 25 years from now should be a no-brainer in the state. Another thing is domestic resource mobilization. Our state is blessed in that there's a lot of industrial, or will I say corporate activity that takes place. And so by 25 years from now, I would be hoping that we have found a way to structure some of those contractual engagements within the state so that there are developmental benefits to the people. So it's not just about health, but it's also about education. It's also about nutrition. We have to start interrogating our economic environment so that, because we know, and I shared this recently in an interview, that businesses are called going concerns. I remember that from studying business studies and economics in secondary school. Health is also a going concern. education is a going concern. It will never stop. So how can we marry these health and developmental needs with our economic going concerns that we know that our state is blessed with? So that at every point in time, we have steady sources where we know that revenue can be earmarked for healthcare delivery. That way, when you're in discussions, because I think somebody said something about partnership, when you're in discussions with potential partners, you are coming from a place and a position of strength, capacity, and competence. You are self-reliant, but we're engaging as partners to see what each of us can bring to the table to magnify and amplify what we're doing. So that is also another thing that I would hope by the time we're speaking 25 years from now, these are things that would have in the state. The other thing, which was something I left out when I was talking about the achievements in the health sector, was the emphasis on strengthening the referral system. So you have primary healthcare on one side, you have the teaching hospitals on the other side, but there's something I call the missing middle. And for a very long time, that middle was neglected. These are the general hospitals, the cottage hospitals, the zonal hospitals. Imagine that there's a complicated case in a primary healthcare center. That case should never be referred immediately to a teaching hospital. There should be a standard hospital within some radius of the community where you can refer such a patient to. And if they are then unable to manage that case, then they can refer to the teaching hospital. We should regard our teaching hospitals as citadels of health, education, training, research, and development to be managing day-to-day cases. 75 to 80% of the healthcare challenges people will have can be adequately addressed at the primary healthcare level. And so strengthening that middle by ensuring that you're equipping, staffing, and investing in that general hospital, zonal health hospital environment, strengthening that referral chain is also something that I would be looking forward to our having. And so another thing would be data, health information management. We shouldn't be reliant on paper-based medical records by 25 years from now. And some of the initiatives we started in electronic medical records, patient management, and health facility management as well, and also tracking for regulatory purposes, we are hoping will be scaled sufficiently and become ingrained within our healthcare system, our healthcare ecosystem in the state, so that somebody is relocating from one part of the state to another, they can still have access, their care team can still have access to their medical records. Of course, knowing, being mindful of issues like data privacy, confidentiality, and all that, but easing the process for people to move from place to place and still have continuity of care. That is where technology can come in. Of course, telemedicine, we saw the benefits during COVID-19 when people couldn't go into health facilities. It's also something that can strengthen the delivery, the provision of services, especially in rural and remote locations.
All right. Thank you very much. In 25 years, if we could be at this point, that would be really something. So be great. So
yeah,
hopefully,
I actually also forgot to say we should be a medical tourism destination by that time. There really shouldn't be any reason why we shouldn't be by then.
I totally agree with you. Absolutely. Well, we've heard in about 10 years' time, the population for the state is going to increase is going to grow by about 4 million people. So how do you think we can utilize maybe family planning to address this issue?
So, yeah, that was also an achievement that I failed to mention. It slipped my mind. For the first time, the state government invested substantially in reproductive health commodities, family planning, contraceptives, and all that. And it also included training of healthcare workers at the community levels, and not just, which is something I'm really passionate about, not just healthcare workers in our facilities, but we also engaged traditional birth attendants, because we know that there are some women who we will miss in our health facilities who regularly patronize traditional birth attendants, so that those TBAs can even advise them on going to the health facilities to get access to reproductive health products. Because we see it as a community thing. If you domicile the information purely at the ministry, on our websites, on our notice boards, maybe on the one-off radio chat or interview, and you don't engage the communities directly, your commodities will be there. They will be asked by maybe 5 to 10% of the population who use the facility, who are eligible for those products, and the rest will just be there and expire. So to actually get communities the relevant demographics for these products to use these products in an informed manner, meaning that the healthcare workers have told them, these are your options, this is the benefit of this one, this is the side effect, and together they choose what works best for that patient or for that client. Unless you do that, you're not going to make any headway. So the state can invest the funds, and it doesn't translate to actual utilization of the products. And so for us, it wasn't just about, oh, River State government has brought out X amount of money into reproductive health products, but embedded in that whole initiative was last mile distribution, training, and community sensitization on its use. So if we're able to get to the point where none of our facilities is stocked out of reproductive health products, meaning anytime someone comes in and makes an inquiry, she can get access to that commodity and be trained, counseled on it, and start using it, we should actually see some regulation of the forecasted population explosion.
All right. Thank you very much, Mrs. Adaeze Oreh. It's been quite an insightful few minutes we've had together. At this point, we would like to take some questions from the listeners, and I'll read one or two out from the chat, so you can start from there. Any other person who would like to ask, you can just indicate by raising up your hands. We'll just take maybe two more, so we don't run too far with the time. So first, from Brenda, she says, what is the River State government doing to support people with disabilities, especially children?
Well, I think in the week prior to the declaration of state of emergency, I received a delegation at the ministry. It was one of the organizations of people living with disabilities. And one thing we managed to establish then was to incorporate. So there was a desk officer in the ministry. There was a desk that was dedicated to gender issues. So we decided to broaden that to disability issues as well. And we were actually working on a program of enhancing access for persons with disabilities in our health facilities. So not all the facilities are accessible in that regard. And that was one of the things that we're actually looking at doing. But the whole point of having that desk was we wanted a focal point where we could engage with the community themselves. So it's not just about us thinking, oh, what do they need? And, but engaging with them who have the lived experience, because there are things you can theoretically think of, but then there are experiences that you need to be living it to see it as an issue and come up with even potential solutions. So wanted that avenue of engagement. And so that was why the desk was established in the ministry. And so hopefully as things start to normalize and settle within the state, there should be more initiatives coming out of that engagement that's that make the health system more accessible for persons with disabilities, especially children who are having this double or dual vulnerability. First of all, they're children, and then they are living, with disability as well. So hopefully those are some of the things that we will have good steps in the near future to report following from the creation of that focal point in the ministry.
All right. Thank you very much. So this is from Stephanie. Samson, I can see your hand. We'll take your question next. This is from Stephanie. She says, what steps is your administration taking to ensure that all categories of medical professionals are meaningfully carried along in health policy design, program implementation, and leadership opportunities within Rivers State's healthcare system?
Okay, so for the policy design, program implementation, in fact, I'll start with the design. For the design and co-creation, what we established was an interactive system where we have a stakeholder engagement and professionals from across board who are involved in, who would be beneficiaries or recipients, will I say, of that policy, are invited to take part in the engagements that would form the first critical steps towards the design of whatever said policy. Now, at the ministry, we tried to have an open door access policy where, any professional group could get access, could send in their ideas, could have a sit down and engage, because I'm of the mindset that health has multiple stakeholders, because everybody has a stake in health. And so one of the things that was I did in the first few months of my appointment was I opened a folder and I called it Community Voices. And so anything anybody tagged me on social media or sent it into the ministry about a particular community and a gap in healthcare delivery in that community went into that folder. And I referred to that folder on a weekly basis. And I can tell you that a lot of the initiatives were drawn from those submissions. You cannot expect to move the needle on healthcare delivery if you're not engaging with the players in the healthcare system and the communities. And so for us, that was clear. And I would hope that is something that continues within the Ministry of Health environment, bringing together all categories of medical professionals, engaging with them on the problems we're seeking to solve, and trying to craft out solutions together.
Thank you very much. I believe if most public service servants work with the amount of intentionality you work with, by now we would have been at a totally different level. Thank you. Samson, we would love to hear a question.
All right, thank you so much. Good evening, Ma. I'm so excited to be on this call with you. And it's also an honor to actually learn from you and then to be inspired by your story, by your journey on how you've started as a medical doctor up to this point. So my question, first of all, is I would like to ask with all sense of humility right? So because I myself also am a civil servant and I also work in the healthcare sector. Like I currently work at the University of Port Harcourt Teaching Hospital. But one of the things I've noticed is the fact that why the providers of facilities and of course stakeholders like government are trying to make healthcare more accessible, more qualitative to the patients. You find out that sometimes the patients themselves do not, I would say perhaps lost, right? They do not know how they can take advantage of these provisions to get better healthcare services. So the point is sometimes you find out that patients, just like you mentioned, a lot of cases where patients they have can be adequately treated at the primary care levels. And you find out that somebody has malaria, they're coming to the teaching hospital. Somebody has fever, they're all coming to the teaching hospital. And these institutions are overcrowded and overburdened. And you find out that, I think one of the research I conducted over working, I find out that on average, especially at the GOPD, you find out that patients wait approximately 85 minutes just to consult with the doctors. Now, I think that if patients are aware or if there are ways to help streamline the journey of patients into the healthcare sector, that this can help solve some of these issues. So what I mean is, for example, if there are tools that can help patients, of course, connect to the first or the closest healthcare provider or facilities within their states to get healthcare services. And then when at that point they do not get the services they can, or if there are complications, they can be referred to the next level, maybe it's the secondary or the tertiary level.
Yeah.
So my question is, to do this, I've currently, this has led me to an entrepreneurial journey, because like I've also had background. I've done some of entrepreneurial trainings like the Tolly Foundation and all that, and I'm currently working on an healthcare startup myself, and we're currently being incubated by a blockchain company and all that. So my question is, because I think for we to actually make an impact, right, like you also rightly said, there has to be a co-creation. So that means we're engaging with the right people, with the right stakeholders, and with the patients as well, so that we can create solutions that are so relevant and will be able to solve some of these challenges. So my question is, how can we initiate this partnership with you? How can we approach the ministry, to be able to, strike a partnership so that we can co-create solutions that will better solve some of the challenges that rivers indigents are facing in accessing healthcare services? Thank you, ma'am.
Thank you very much, Samson, for that question. Well done on your healthcare initiative, and congratulations. I mean, the Elumelu Foundation grant is highly competitive, so well done on securing that. I would say that you raised a very important issue, and that issue boils down to trust. To be honest with you, there's nobody in any community who would happily go and spend 85 minutes in a teaching hospital waiting to be seen if in under 1 hour they could go to the primary healthcare center, see someone, get whatever medication, and be back home. There's nobody. Nobody. But the truth is that trust is eroded. They'll go to a primary healthcare facility, no matter how close to them, and maybe staff aren't on seats. It happens the first day, you can give an excuse. The next day, there's nobody there. Third day, but they know that when they go to the teaching hospital, last by 5 p.m., somebody will see them. So it's a trust issue. And so for me, it's also about the responsibility that those of us in the policy implementation arm have to ensure that the facilities that state funds are funding are there and available for the people to benefit from. In Nigeria, there's each man for himself, each woman for us. People will go to the places of least resistance if they have a very close facility and they can't get that care there. It defeats the whole purpose. So they'll rather journey to where they will wait endlessly because they are almost certain that at least someone will give the care they need eventually. So it brings us back to the problems we've been discussing all along. We need to get our facilities functional, and not just functional in terms of the infrastructure and the equipment, but the people that are available to deliver the service. They have to be there, they have to be available, they have to see the patients. And on our side as well, we need to be open to complaints and criticism. That is how we can improve the system. We shouldn't take it as a non-loyalty or a non-support. It's about improving the system. It's about delivering what we are promising we will deliver. And so for your question about engaging for co-creation based on what you've developed, like I mentioned earlier, I mean, the state is kind of in a transitionary kind of period. And so when things kind of settle at the ministry level, then, you know, feel free to submit your proposal and be called in for a meeting to discuss on possible areas of collaboration and co-creation of solutions to some of these problems. But when you were speaking and asking the question, you need to incentivize people to access some of the initiatives you put up, because like I said, they're coming from a place of distrust in the system. So imagine that we have created this functional, we have working staff, the equipment is there, the PHCs are revitalized, but you have to get people to shift from the mindset of that abandoned PHC to this new ultra-modern PHC. So these are some of the opportunities for health insurance. So can we possibly build in the fact that you won't get health insurance coverage at a tertiary hospital if you have not gone to a PHC first? Is that possible? It is possible, but there's a burden of responsibility for us in government to ensure that those PHCs are actually working. So that way, you can actually say, no, madam, nobody will pay for this. You don't have coverage because you haven't first gone to your PHC. So even the PHCs will be under pressure to deliver. So these are just some of the thoughts and some of the things that, you know, we could work around and see how to get our systems working. It is possible.
All right. Thank you very much, Mom. You've done a great job today. Thank you once again for giving us audience and enlightening us in all the ways we can better help better the River State health sector. Really grateful and appreciative. So lastly, before we call it a day, I would like to know, well, what's the River State of your dreams?
The River State of my dreams is a River State that is recognized for much more than the oil and gas sector or political crisis. It's growing up, I knew River State to be a state with professionals, people with sound skills, articulate, a culturally diverse and beautiful state. And I would like for River State to be recognized as maybe the state with the happiest people, the states with cultural openness and acceptance, because our identities are enmeshed in our different cultural backgrounds. So if we're together as a people, then we should accept our cultural diversity as part of the beauty of that fabric of River State. And we are a happy people. We are a peaceful people, as recent events will show. But I think we need to portray a lot of what we know is in the potential of Rivers people. We need to bring it to the fore. We need to bring it to national limelight. People should see and know that Rivers State is beyond oil and gas and, you know, what have you in the press space. Because let's go back to that HIV article again. If that article was about how Nigeria has halved its HIV prevalence. Now, that's the true situation is that the national figures are down, right? There is improvement across states with regards to HIV. But those articles, because it wasn't just one media house, those articles portrayed it in a negative light. 2 million people are living with HIV. Meanwhile, it was 2 million plus before. It has reduced, but it grabs headlines. And because it was meant to be portrayed negatively, Rivers State was the first state that was listed. The rivers of my dreams is that we'll be the first to be listed when positive developmental issues are discussed. That, in a nutshell, is the rivers of my dreams.
Positive developmental issues are discussed. Thank you very much, Dr. Adaeze Oreh. Thank you very much. I'll hand over to Ebenezer now. Thank you very much once again.
Thank you.
Thank you so much, Honorable Commissioner. Really, really grateful for this 1 hour plus you've given to us and so much more time that you continue to give to support the project. Thanks a lot. Thank you, Asenite, for the conversation. I see that there's so many questions in the chat that we couldn't take for those who are in the task force. And for those who know Dr. Oreh online, you know she's very active. She handles her own accounts by herself. So feel free to engage with her on social media as well with some of those questions that you might have. As you know, this conversation was being recorded, so we're going to have the recording on YouTube, along with video bites and stuff like that. Stay in touch with the work that we're doing, rivers2050.org. We're trying to see how we can get as many people as possible to complete this survey. So please, if you haven't filled the survey, rivers2050.org/survey, so you can take part in the statewide survey that is currently ongoing. Yeah, she handles her accounts herself. Yes, she does. So yeah.
Did somebody actually ask, is that true?
Yeah, because many people in government do not handle their accounts themselves. So it's something that is not the norm. So yeah, she does handle her accounts herself. Yes. Okay, thanks everyone. Have a great rest of your evening. Thank you so much again, Honorable Commissioner. Wishing you all the best in your work and your efforts to make Rivers State great. And thank you for your support to the project.
Thank you so much. Thank you for the initiative, and we'll continue to do our bit, all of us here, to get to the rivers of our dreams.
Thank you. Thank you.
Thank you.
We will. All right, everyone. Bye.
All right. Bye-bye.
Bye.